New research suggests ADHD medication doesn't just help with focus. It could also lower the risk of substance misuse, suicide attempts, traffic accidents, and even criminal behavior. Today we're breaking down the study, what it means, and why it's sparking big conversations in healthcare.
ADHD, attention deficit hyperactivity disorder, affects about 5% of children and 2.5% of adults worldwide. While stimulant medications like methylphenidate, often known by the brand name Ritalin, are widely prescribed to manage symptoms such as inattention, hyperactivity, and impulsivity. A new study published in the British Medical Journal followed 148,500 people in Sweden, aged 6 to 64 with ADHD. Over half of them, 57%, began drug treatment.
So, what did the researchers find?
They discovered that people on ADHD medication had significant reductions in several high-risk behaviors: 17% lower risk of suicidal behavior, 15% lower risk of substance misuse. When they looked at repeated incidents, the benefits were even clearer: 25% fewer cases of substance misuse, 25% fewer criminal behaviors, 16% fewer transport accidents. Researchers believe these benefits may come from medication reducing impulsivity and improving concentration, two core challenges in ADHD. Better impulse control might mean fewer risky decisions while driving, less aggression, and fewer opportunities for self-destructive behavior. Professor Samuel Cortese, a lead author from the University of Southampton, said, "Oftentimes there is no information on what the risks are if you don't treat ADHD. Now we have evidence these drugs can reduce those risks."
Of course, not everyone is convinced this means medication is the solution for everyone.
Critics point out the study can't fully rule out other influences like genetics, lifestyle, or the severity of ADHD symptoms. Also, the research didn't confirm whether patients consistently took their medication. And while the benefits are compelling, ADHD drugs come with well-known side effects: headaches, loss of appetite, and trouble sleeping among them. This study also highlights a major challenge: access. In the UK, for example, there can be years-long waits to see a specialist after diagnosis and begin treatment. Some countries also face medication shortages. Experts like Professor Stuart Kinner say untreated ADHD can lead to self-medication with alcohol or drugs, poor mental health, injury, and incarceration. In other words, treatment could be life-changing far beyond the classroom or workplace.
This research suggests ADHD medication may protect people in ways we've never fully appreciated. Not just improving focus, but potentially reducing life-threatening risks. The challenge now is making sure those who need it can access it, while still balancing the benefits with the possible side effects. What do you think? Should this kind of evidence push more doctors to recommend medication earlier? Let me know in the comments.